Today we're going to go over all the structures on the external and internal heart. So we'll start off with the chambers. So the upper chambers of the heart are called atria. Singular is called atrium. And we want to make sure when we do this, we orient ourselves to left and right. So when we're looking, this is the left side of the heart, this is the right side of the heart. So we want to make sure we're always labeling left or right. The only time we don't label left or right is when left and right doesn't exist. Okay, so if there is a left or right, regardless of whether it's listed in a textbook or in a lab manual, you're always going to label left or right. All right, so this chamber on this right side is going to be called the right atrium. On the left side, this is called the left atrium. There are structures that are on the atria, okay, that are called auricles. Okay, those structures, so we've got left auricle and right auricle. Now, here's the difference. If I did it on a test and I pointed right here and I said name the chamber, then you're going to say right atrium. If I say name the structure, same exact arrow, you're going to say right auricle. Okay? Now, the lower chambers are going to be called ventricles. So we have the left and right ventricle here. Okay? And then we'll do some arteries coming out of the heart. All right, so coming out of, if we open this up just so you can kind of see, coming out of the right ventricle, we have this artery here. This is an artery. It's called the pulmonary trunk. Now, the reason it's blue is because it's carrying deoxygenated blood. So we don't want to get confused with that because arteries are usually red, right? And veins are usually blue. And so the deoxygenated blood, we want to send that to the lungs. So the pulmonary trunk splits into the left pulmonary artery, and then tucking through here, let's just kind of turn it around. You can see it coming out here. This is the right pulmonary artery, okay? Those are all arteries. Pulmonary trunk, left and right pulmonary artery are arteries. Arteries always take blood away from the heart. Veins take blood to the heart, okay? So these arteries are taking blood away from the heart, deoxygenated blood to the lungs, and then they come back through these veins here. These are the right pulmonary veins, and then here we have the left pulmonary veins, and both, if I turn it around, you can see that both sets dump into this other chamber here called the left atrium. So this left atrium is collecting that oxygenated blood. The right atrium is going to collect the deoxygenated blood from the body, all right? So let's go ahead and do that next. So we've got right atrium that collects the deoxygenated blood. We've got the left brachiocephalic vein, which we see just a little stump of it here, and then the right brachiocephalic vein that are going to dump into this big guy here called the superior vena cava, and that's going to dump into the right atrium. Okay, so it's going to take the deoxygenated blood from above the heart into the right atrium. Then we have, coming from below the heart, we have all of the blood draining into the inferior vena cava, again dumping into the right atrium. Now, what about the blood that goes to the heart tissue? Well, we've got these arteries and veins that supply and drain the heart. We're going to cover those in just a few minutes. But the arteries supply the heart, right? They give the oxygen to the heart tissue. The veins are going to drain it, and they're going to drain, all of these veins will drain into this bag on the back of the heart. Okay, this is called the coronary sinus. And the coronary sinus, guess where it dumps into? Right atrium with the other deoxygenated blood. In fact, if we open this up, this is on our list later, but if we open this up, you see that little red dot right there? Can you see that? So that is the opening to the coronary sinus. That's where that little bag on the back dumps into the right atrium, okay? All right, let's keep going. So we've got, coming out of the left ventricle, we have the aorta. Now, you will never on a test put just aorta, and if you look in your notes further down, you will see that you will never put on a test descending aorta. There is a such thing as a descending aorta. It's made up of the thoracic and the abdominal aorta. You're not going to put it on a test as descending because it's too vague. So that would be an incorrect answer. So let me show you the pathway, at least up to thoracic. Abdominal, I would have to show you on a different model. So the ascending aorta comes up out of left ventricle. Okay. Once we hit the arch, so let's kind of draw like a line right across there, maybe right above that 11, if you can see that 11 there. And so the arch is called the aortic arch. So we've got from just above that 11 to about here. And then going down the back of the heart, you have the thoracic aorta. So again, don't call that descending, that's thoracic aorta, because we want to be specific. And then down, once we hit the celiac trunk, then it's going to be called abdominal aorta. And I'll try to do another video that'll maybe show that. So, okay, let's come off of the aorta. So we've got ascending aorta, aortic arch, thoracic aorta, and later on, abdominal aorta. We have three arteries, B, C, S. That's a little mnemonic there to help you remember it. B is for brachiocephalic trunk. The C is for the left common carotid artery, and the S is for subclavian, so left subclavian artery. Now, there is a right subclavian and a right common carotid that comes off of this trunk. Again, I have to show that on other systemic models. Okay, so let's see where we're at. Let's go ahead and look at this guy right here. So we've got artery, which is pulmonary trunk. We've got artery, which is the aorta. And then you got this little ligamentous type structure, okay? This is called ligamentum arteriosum. And so it connects these arteries, and it's a ligament type structure there. And let's go ahead now and do these small vessels, all right? So we need a blood supply for the heart. It's called the coronary circulation. The coronary circulation is a branch of the systemic circulation. And so that means it's going to supply the tissues of the body, okay? So we need circulation for the heart tissue. It's going to be the coronary blood vessels that do that. So we've got coming off the aorta, the right coronary artery. So let's trace it so you can see the path traced. Okay, so all of this is right coronary artery. But we have a branch down here. We get another name. We have a branch down here called the marginal artery. So you see that one right there, number 63 right there. So that's called a marginal artery. And if we were to go around to the posterior side, now remember something, the heart is not completely symmetrical. So if we're looking at the anterior, if we turn it directly around, right, that's what it would look like. But that's not the posterior. The anterior is this surface. The posterior is this surface. So again, it's not completely symmetrical. So when we look at it, these are the ventricles, and this is between the ventricles right here. So when we look at this artery that's coming down on the posterior side between the ventricles, now don't forget, you're looking in the same direction you're facing now. So now this is left and this is right. So we want to be cautious of that when we're labeling left and right for different arteries and veins. But this one is right in the middle. It's on the posterior side between the ventricles, so we call it the posterior interventricular artery, okay? We'll rewind here to the front. Now, you can only see a small portion of it here, but if you look, see this 29 and above? So this little piece coming down to 29, that is the left coronary artery. But it actually starts at the aorta and tucks behind the pulmonary trunk. You just can't see it on the model. And then it pops out here. And at 29 is really where it stops being left coronary artery, and then we get names of the branches, okay? So 29 is about the last place we would call it left coronary artery. When we go down the front of the heart, or the anterior of the heart between the ventricles, we call that the anterior interventricular artery. When we circle around the sides, we're gonna follow and trace, we go all the way around, all of that, okay? That is the circumflex artery. So make sure that we go left coronary here, anterior interventricular, and circumflex, right? So those are the arteries branching off there.